All right. As the most common presentation of a musician to the clinical space is pain and with associated MSK and neurological problems, we decided to begin our work in this area. So we asked ourselves these two essential questions. One, are we able to confidently measure the effect of our clinical care on musicians' patient centered clinical outcomes with valid and reliable tools? And two, do we know and agree on the competencies needed in healthcare professionals to provide safe and effective clinical care to musicians with MSK and neurological problems towards achieving their patient centered outcomes?
Our extensive convergence meetings and comprehensive literature reviews revealed considerable gaps in these two areas, which we're going to be explaining in more detail today. Then we ask ourselves, what is the path forward to advance clinical care of musicians? So we've decided in this phase of our work that it is of critical importance to begin with the following two actions. Number one, to set a consensus-based research agenda to begin working towards determining the musician's patient-centered outcomes and to confidently measure the effect of our clinical care on these outcomes. Secondly, to determine by expert consensus an initial core set of cross-disciplinary competencies important for healthcare professionals in addressing MSK and neurological conditions for musicians. We have also generated a set of consensus items on organizational and institutional responsibilities towards formalizing musicians' healthcare to recruit and sustain the involvement of generations of healthcare professionals through discipline-specific, board-certified specialties for physicians, occupational therapists, and physical therapists. So now we'll present to you the specific consensus items we generated on outcomes and competency topics. So we're going to begin with Dr. Anna Zhao on the screen up here on the outcomes. Thank you.
Good morning, everyone. My name is Anna Zhao. I'm the medical director of the International Center of Arts Medicine in Portugal. I'm a researcher and lead professor of medicine and music at the University of Porto, medical officer at the European Commission, representing Portuguese ministries as expert at the group Culture and Health, and I'm also a pianist. First, please accept my apologies for not being able to join you in person today, but I'm very grateful for the opportunity to contribute to this important discussion from afar. Let me begin with a simple but critical problem. We need the right tools to be able to measure whether clinical care is effective for musicians in a reliable and standardized way. Despite the growing number of clinics and providers treating musicians, we continue to lack valid and reliable outcome measures that reflect the real impact of care. Many of the tools currently in use are borrowed from general musculoskeletal medicine or from mental health or occupational health, and although useful in some respects, most are not tailored to the realities of musicians' bodies, performance demands, or values. In our updated systematic review, we identified 23 patient-reported outcome measures used in musicians' healthcare. 19 came from the original review and 7 were newly identified, but we still lack studies evaluating their responsiveness to change. Only one responsiveness study so far. A fundamental property if we want to know whether a clinical intervention actually works. This means that the tools we are using today are not only limited in scope, but also lack the kinematic rigor we would require in any other field of the evidence-based medicine. And most of them are single-dimensional. They may capture pain or anxiety or performance difficulty, but not the interconnected experience of being a performing artist dealing with an injury. Concerning pain, we already have a multidimensional tool with good psychometric properties, which also capture artistic dimensions and is specific for musician, the PPAM, which is currently being validated in other languages around the globe and which the responsiveness to change is being tested. However, we still need additional tools that capture other outcomes relevant and meaningful for musicians. So here we are, trying to build clinical guidelines and interventions for musicians, but still lack solid outcome data to support or evaluate them. Even more importantly, we don't really know what outcomes matter most to musicians themselves. If we want to define patient-centered clinical outcomes, then we must start by listening to the patients, to the musicians. What does success mean to them? What's meaningful beyond just pain reduction? Is it about sustainable technique, confidence on stage, creative expression without fear of relapse? Trying to solve this problem, for example, during PPAM development process, we also included panel meetings composed by musicians to hear from them what is meaningful and to understand the most appropriate way to evaluate it. Without this insight, we risk developing tools that are scientifically sound but clinically irrelevant, or worse, measuring what's easy rather than what is meaningful. Looking ahead, we need to co-design outcome measures with musicians. We need multidimensional tools that can capture physical, psychological, functional, and artistic dimensions of health, and we need to subject those tools to rigorous testing, validity, reliability, and responsiveness, so they can become true assets in both clinical care and research. The essence of this foundation is not just a research issue, it's a barrier to delivering effective, equitable, and accountable care. Thank you again for including me, even from a distance.
Thank you, Anna. All right, now she's going to come back to talk about
I have
methods.
held over 60 hours of convergence meetings with 105 international experts and several hours of consensus building meetings with our steering committee. And with our steering committee and grounded in the preliminary findings from our scoping review, we generated a list of 6 core outcome items. And after completing the Delphi round 1, we added a feasibility item based on the outcomes that emerged from it. We are excited to share with you our preliminary results of round 1 of all 7 core outcomes. We are now analyzing the results of round 2, and finally, we plan a third round, which will help us refine and strengthen agreement on each item as we move toward a finalized outcome framework.
Next, we're going to hear from Dr. Christine Guptill, who will present outcomes consensus item number 1.
Hi, my name is Christine Guptill, and I'm an associate professor at the University of Ottawa in Canada, an occupational therapist and an oboist. I'm the co-director of the Canadian Network for Musicians' Health and Wellness, a founding member of Mental Performance in the Arts Canada, and I've worked on and off since 2007 with musicians from National Youth Orchestra Canada and other musicians. Consensus item number 1 is important to me because many of us as healthcare providers and researchers have believed for some time that we need to have a solid understanding of what musicians want to be able to accomplish in order to give good advice that will be valuable for the musicians. In any healthcare discipline, if a patient doesn't believe that we understand what they do and what they can and can't control, such as orchestra rehearsal schedules, repertoire selection, or the way people generally hold the bow of a violin, they will most likely not follow our advice, and any equipment we provide might end up in the closet unused. This is why a number of clinicians and researchers have talked about the importance of understanding the language of musicians, how to take a good clinical history, and other suggestions. Some challenges we face include a lack of assessment tools and outcome measures that we agree can help us determine how musicians are doing now and during their treatment. What we've recommended here is that everyone who has a role to play in the musician's well-being should be involved in helping to determine what are some of those things that are important, impactful, and meaningful for musicians. We can move towards understanding this better by reviewing the literature carefully, including studies that use statistical methods, those that use interviews and focus groups, and studies that use both. And we need to carefully consider what might be left out of that literature, either because it wasn't published or because of power differences. For example, when people keep injuries hidden or when they encounter issues of abuse in the workplace. We also need to put the time and effort into building trusting relationships with musicians, individually and in groups, to hear what's important to them. Doing things like creating expert panels to ensure our treatments and research meets their needs, and including opportunities for different parties with an interest in musicians' health, such as administrators, unions, healthcare professionals, and researchers to exchange ideas in a way that values everyone's voice, especially the musicians.
Thank you, Christine. Next, Dr. Jessica Stanhope will present our item number 2.
My name's Jess Stanhope and I'm a Chief Medical Scientist in the Rheumatology Unit at the Queen Elizabeth Hospital and a Senior Research Fellow at the University of Adelaide in the School of Public Health. Now, before being a researcher, I was a physiotherapist, and prior to that, I was actually a musician. And the reason I left music was because of a chronic musculoskeletal condition. So I've experienced both sides of this situation, both as a patient and as a clinician, and the challenges around gaining that shared understanding of how the patient is actually going with their treatment. We've obviously got those existing tools that are available that aren't specific to musicians, and they don't tend to capture the things that are really of importance to the musician. So this is something I'm incredibly happy to be a part of, and the recommendation that I'm speaking about refers to looking at the existing tools that are available to assess this clinical effect of our treatments on musicians with musculoskeletal and neurological conditions. So this is obviously a really big task, and so what we're recommending is that there be a critical review of the literature that be conducted by researchers working with musicians. But importantly, this is in collaboration with clinicians and musicians. So it's not entirely a venture conducted by researchers. In addition to this critical review of the literature, we're recommending that there be an inventory conducted of the clinical tools that are available. Now, this should be looking at multidisciplinary outcomes that we can be using for assessment, and isn't just about the existing tools that are available, but also identifying those that are currently in development and that are being used in routine care. This is obviously a really big task. It will take a lot of resources and a lot of time, and there will need to be some prioritisation along the way. But the 4 key areas that we're recommending this work focus on are looking at the published consensus-based outcome sets that are of relevance to musicians, that we're looking for patient-reported and objective assessment tools that are being used or could be used with musicians with musculoskeletal and neurological conditions, that we're learning from adjacent fields. So we're looking at outcomes that are being used or that are being developed for use with athletes and other sports people, as well as areas like dance medicine. And then finally, we're looking at the functional areas and domains that are in existing frameworks. For example, the International Classification of Functioning, Disability and Health, or the ICF framework from the World Health Organization. By having this really strong foundation and really good understanding of the current tools available, we can better guide these next steps, both in terms of capitalising on those gaps that are available, as well as what is currently available to us. Thank you.
Thank you, Jess. And now we have an in-person presentation calling Dr. Aviva Wolff to the podium.
Thank you, Sarat, and I'm just so inspired by everything I've heard already today. So I'm here to present on consensus item number 3, identifying the domains of function that matter most for musicians. Now, we all know that musicians are unique patients. Their work, here we go. Their work intertwines physical, psychological, and social demands. So when we measure outcomes in this population, we have to go beyond a simple pain scale or range of motion test. What we know from the current literature and our expert meetings highlights a complex interplay between the person, the activity, and the environment. So we can think of it in 4 core areas. First, pain and other symptoms, understanding how pain, fatigue, or discomfort affects a musician's daily life and performance. Second, the bodily functions and structures, so not just muscles and joints, but the whole person and how the physical and psychological impact and interact. Third, activities and participation, right? The ability to practice, perform, and manage symptoms, as well as how confident the person feels in preventing re-injury. And lastly, the fourth are the environmental and personal factors. So the role of working conditions, personal circumstances, and external influences that shape performance and recovery. With this in mind, our recommendation is very clear. Researchers, clinicians, and musicians, as we've already heard, must work together to define and validate the most relevant domains for patient-centered outcomes. We have strong frameworks like the ICF, the International Classification of Function Disability, which can guide this work, but this will take time, collaboration, and focus. By aligning outcomes with what truly impacts musicians' health and performance, we can ensure that treatments and research have meaningful long-term benefits for this unique population. I'd like to now call Dr. Ralph Manchester up to the podium.
Thank you. Excellence in healthcare for musicians requires balancing evidence-based standards of care with the specific circumstances of the individual performer. And the research to generate those evidence-based guidelines should be linked to outcomes that are meaningful to our patients. In both the research and clinical settings, we need to have a core set of outcomes that are specific, easily measurable, and at least some should be relevant to the musician. These outcomes will vary depending on the specific problem, but they should be written to allow for comparisons among a group of clinical studies or among case series from several performing arts medicine clinics. It's possible that the list that researchers use for a particular problem will be somewhat longer than the list used by clinicians seeing patients with that problem, but there should be considerable overlap. A number of medical specialties have developed core outcome sets for a variety of clinical conditions, mainly for use in research projects. While none of them are focused on musicians, some have been written for musculoskeletal and neurologic conditions that have some overlap with performance-related problems and could potentially be used as a starting point for our future efforts. Researchers, clinicians, and musicians should all participate in the development of core outcome sets in order to optimize the usefulness of the measures that are chosen. In general, the core outcome set development process involves 3 steps: identifying a list of potential outcome measures, prioritizing them from most to least important, and finally selecting those that will be in the final set for a particular condition. Again, the research set might differ slightly from the clinical set, but the majority of the items should be identical. Once a core outcome set has been promulgated for a specific condition, it should be reported in all published studies of that condition. This will be a significant undertaking for our field, requiring us to identify the financial and human resources for success, but it will be an important step towards advancing the care for performing artists. Now we will hear the next item from Dr. Carl Firle via video.
Hello everybody, I'm Karl. I'm an occupational health physician from Berlin. I present you consensus item number 5. It is necessary that we evaluate the existing tools and that we detect gaps where no tools exist to assess musicians' health and also the treatment and their care. So it's a multidimensional nature, the musician's medicine and health, and due to that, like psychosocial well-being aspects, self-management, instrumental specific factors, all these have to be addressed, and therefore we think it is necessary to do a little research. So reviews, systematic reviews are a very important fact in this building, so it is necessary to view and to review the literature systematically and to find what's already there and what's missing. In the next step, there should be done a design made by researchers, clinicians, musicians, and other relevant experts to address these gaps and to conclude meaningful and feasible outcome parameters and tools like questionnaires. Then, in the next step, these tools and questionnaires has to be validated based on the standards we have. And also different aspects should be included. How well and how good is the detection of this test? There are different statistical parameters to be determined. And all in all, we have to find good tools that really measure what they shall measure. And finally, all these tools and questionnaires have to be made public, probably on a repository for everybody. But we also have to consider cross-cultural aspects and language difficulties and also cultural differences that may impact on these tools and questionnaires. I wish you all a very pleasant Congress in Washington, D.C.
Thank you, Carl. Next up, the technology item by Anna.
Now let's take a moment to recognize something truly exciting. Technology is moving faster than ever. In our daily lives, digital tools are changing how we communicate, how we move, how we manage our health. And in adjacent fields like sports medicine, cutting-edge tools like wearables, motion tracking, and telehealth platforms are already part of standard care. But here's the catch. In musicians' healthcare, we are not moving fast enough. Despite clear need, our field has been slower to adopt and integrate these technologies into clinical care, especially when it comes to outcome assessment. And this matters because these tools are not just futuristic bells and whistles. They have the potential to transform how we understand, monitor, and improve health outcomes for musicians, making care more precise, more accessible, more responsive to the unique demands of performance. Imagine a mobile app that allows a musician track symptoms in real time between therapy sessions, or a telehealth platform that collects validated outcome data without the musician ever needing to leave their practice room. We already see this happening elsewhere. Why not in our field too? Of course, we must be mindful. Technology is not equally available to everyone. Many musicians, especially in lower income countries, don't have access to motion capture labs or high-end devices. So if you are serious about equity in musicians' healthcare, we need to start with what's ideally accessible and build from there. That's why we are recommending this. The research community in musicians' health, together with clinicians and musicians themselves, should prioritize the adaptation, development, and evaluation of digital tools for outcomes assessment. But we must begin with tools that are accessible to all and scalable, ensuring no one is left behind. This isn't just about keeping up with the digital age, it's about making musicians' healthcare smarter, more inclusive, and more effective. We are at the edge of a new chapter. Let's make sure musicians around the world benefit from it. Thank you.
Thank you, Anna. And next up, calling Dr. Matt McCrary to the podium for the next item.
Okay, so I have the privilege of finishing up this initial segment by talking about feasibility and infrastructure requirements to implement the previous 6 items. So in the words of the leadership academic Lee Bowman, a vision without strategy remains an illusion. And I think these words are particularly relevant to this day of impulse and recommendations for improving the health and healthcare of musicians, which, as has been noted previously in this session and in previous sessions, remains a low, or many would say, under-resourced environment. And meaning that we, more than most, require a strategic approach to make sure that we efficiently build the future that these consensus items and recommendations aim to create, and in so doing, make the most delicious possible lemonade from our performing arts medicine lemons. And that's what this cross-cutting 0 item, or this prequel item, aims to do, which is to guide the efficient translation of consensus items to new validated patient-centered outcomes specific to performing artists and performing arts medicine. And specifically, this zero item proposes a coordinated strategic implementation plan consisting of 6 concrete steps to address the feasibility, sustainability, and costs of actually doing what's proposed in these prior 6 consensus items. So these 6 concrete steps are: number 1, a needs assessment to identify the specific clinical, contextual, and logistical requirements of carrying out what's proposed in each of these 6 consensus items. Number 2, an evaluation of institutional and community readiness, including an assessment of whether appropriate settings and committed, qualified researchers are able to carry out these required studies. Number 3, and related to this previous recommendation number 2, dedicated teams and infrastructure should be created where necessary to carry out the required work where there are gaps identified in number 2. Number 4, an appraisal of the short and long-term feasibility of conducting the studies proposed by and related to these prior consensus items should be conducted, considering resource availability and constraints, institutional support, and any foreseeable barriers. Number 5, the development of clear research plans to track progress towards implementation, including defined steps, timelines, milestones, and accountability mechanisms. And then finally, number 6, establishing formalized structures to support early career scholars, including funding pathways, mentorship opportunities, and academic recognition pathways. Through these 6 preparatory and sustainability steps, we can most efficiently dedicate our time and resources towards creating these new patient-reported outcome instruments specific to the performing arts medicine context and the performing arts context, increasing the likelihood that these recommendations and consensus items presented today are a starting point and not an end point for performing artists. Thanks.
Okay, and now we will hear the results of our round 1 from Dr. Zhao.
What an energizing summit we are having today. Now, before we close the outcomes consensus items, I'd love to share some great news about how our expert panel responded in round 1 of the Delphi study on clinical outcomes. We had 100% participation. That's right. All worldwide 50 invited experts completed the round. That kind of full engagement is rare, and it speaks volumes about the patient and urgency around this topic. It is also the result of SERAP continuous effort to maintain the engagement and motivation of all involved. Thank you for that, SERAP. Even more impressive, every single item passed with flying colors. Across the board, there was overwhelming agreement on the key outcome priorities we've been discussing. That means our community is not only aligned in principle, we are aligned in the details too. Of course, your comments mattered. We are now refining the items based on the excellent feedback we received, tightening wording, clarifying item, and ensuring these outcomes reflect the real-world needs of both clinicians and musicians. What's clear in this? There's a strong shared commitment to moving forward with better, more meaningful, and more inclusive ways to measure clinical effectiveness in musicians' health. And this is just the beginning. Together, we are laying the groundwork for outcome measures that will actually serve musicians, tools that are valid, responsive, and centered around what matters most. Thank you all for the incredible energy you are bringing to this work. Let's keep building together.
Thank you, Anna.